Hello, my name is Sarah Price, and I'm from St. Nicholas Hospice Care, and I'm going to talk to you a little bit about something called compassion fatigue. This is for direct service key workers and generally geared towards medical people, HCAs, nurses, doctors, etc. Professional carers in these fields connect with others in ways that are difficult to explain and even difficult to understand. But basically, it's our ability to emotionally connect with patients. Let me repeat that. Our ability to emotionally connect with patients and families is a gift, but it's also a challenge, especially in these trying times. And what happens is we have professions that are built on our own personal empathy. That's why we've gone into these fields. And in these times, in all times as medical people, we can use up that empathy, and you can't pour from an empty vessel, as they say. So what's the difference between burnout and compassion fatigue? I think many professionals refer to their compassion fatigue as burnout. They need to take a holiday, they need to go away for a bit, they need to take a break, and then they come back rejuvenated. And when you come back rejuvenated, that's compassion fatigue. Burnout is when you just can't really be in this field anymore, you can't refill. And burnout arises from the normal stress and change, but compassion fatigue arises from your emotional and personal feelings for the suffering. Burnout is associated with stress and hassles involved in your work. It's cumulative, it's relatively predictable, and like I said, frequently a holiday or a change in job or career remedies it. Compassion fatigue, on the other hand, is a state of tension and preoccupation with the individual or cumulative trauma of clients as manifested in one or more ways. We have a lot of people very ill right now. We have people dying. We have people dying alone without their family members, and that becomes very traumatic for our direct workers to deal with. Absorbing the trauma through the eyes and ears of your patients and their families and clients, and the emotional residue. Compassion fatigue is a state of tension or preoccupation with the cumulative trauma of clients as manifested in one or more ways. And we'll talk about that in another recording. Right now, we want to talk about symptoms of compassion fatigue. It's problems with attention, loss of stimulus discrimination, internal noise, internal dialogue that keeps you from hearing what's going on around you. It can be avoidance and numbing. It can be compulsive behavior, self-destructiveness. It's an inability to modulate your arousal, being hyper vigilant. Exaggerated startle response, misperception, and losing your sense of self. And there's a high level of cost associated with this from two different perspectives. One, from an organizational perspective, it's a job performance goes down, and people are ill and become ill more quickly or more easily because of their immune system gets compromised. Mistakes go up, morale drops. Personal relationships are affected on a personal level, on a worker level. The cost to them is high with personal relationships. Personality deteriorates, and like I said, an overall decline in health, which we really can't risk in this day and age. And how to avoid it is to recognize that it happens and accept it. And I mean that on both an organizational level and a worker level. St. Nicholas Hospice is very aware of the fact that this happens, and I would hope that most organizations feel the same way and understand that we're in a heightened time of risk for compassion fatigue. But it's important for the worker, the key worker, to recognize it as well. Recognize and accept. It's a natural outcome of trauma, and these are traumatic, crisis-ridden times. It's an occupational hazard for key workers who rely on empathy to do their job. Of course, that means that empathy is a heightened chance for you to encounter the compassion fatigue at some point in your career. And this would be a normal time for that. It's a normal response. That putting yourself first is difficult for, I think, a lot of direct service workers to do, but it's key. Just like when you're on an aeroplane and they say when the mask comes down, put it on your face first before you do the baby. It's the same idea that you can't pour from an empty vessel, that if you are not well, if this takes a toll on you and you're taken from the front lines, all the other people will suffer as well. And then create emotional boundaries as best you can. seems counterintuitive, but to have a more holistic approach, and I think we all consider ourselves holistic workers, when you get too close and you internalize too much what's going on in a patient's life, you can't be holistic. You know when you're assessing a patient that you need to look at everything, psychosocial, as well as the whole body and any comorbidities or anything else you're looking at. But that if you have internalized that because of this pandemic and what they're going through, or because of their diagnosis, it's the same as my great aunt Susie had, it hinders your ability to look at them holistically and to try to find a support network. The next video recording will have some more ideas on how to identify how you're being affected by compassion fatigue and some self-care ideas. I hope this was useful.